Okay, I'm Miss Carter. This is my head to toe assessment. So in general head to toe, I would come in the room, introduce myself to the patient. Hi, my name is Sara. I'm going to be your nurse today. What's your name?
Nick.
What's your date of birth?
12/20/97.
Do you know where you're at?
Yes.
Where are you?
I'm at your house.
Okay. Do you know what month it is? Do you know what month it is?
April.
Do you know who the president of the United States is?
Donald Trump.
Okay. Okay, so as I'm talking to him, just going through the mental assessment, I also make sure I brought in all my equipment, which I have right here, and I'd wash my hands, and I've already, verbalized I've taken blood pressure and vital signs, everything like that. Just observing him, I don't see any masses, tenderness, lesions, swelling, anything of concern. So starting the exam, I'm going to go ahead and start. So look at his arms. His fingers are kind of orange from work, but I'm going to do capillary refill test. So refills in 1 to 2 seconds. Do skin trigger test. He's a little bit dehydrated. That's per usual. It doesn't look like he's got any lesions or swelling, anything like that. I'm going to move his elbow around. Don't feel any crepitus. Will you move your shoulder? Okay, sorry. And I'll do the same thing on the other side. Did you know? Not your shoulder, your elbow. Lift your elbow. Okay, sorry, that was my bad. Okay, now lift your shoulder. Okay. Okay, now lift my hands against resistance. Okay. So now I'm going to start inspecting and palpating your hair and your scalp for any masses. I don't feel any masses or abnormalities. Now I'm going to feel this temporal artery. I feel it feels like a 2+. Will you open your mouth for me? Move your jaw for it. Will you open your mouth against resistance? Okay, clench your teeth. Alright. I'm also going to go ahead and close your eyes for me, okay? Okay, so I'm going to test fine touch on his face. Tell me when you feel something touch you, okay? You say ow?
No.
Oh, I thought you said ow. Okay. Alright, so the next thing I'm going to test is your facial nerve. You don't have to do all 3 of these at the same time. I'm going to give you 3 different instructions, okay? Lift your eyebrows for me. Okay, you can put those down. Close your eyes really tight. Alright, you're good. Now smile really big. Okay, you're good. Now pump your cheeks. Okay, you're good. Alright, so now I'm going to palpitate your lymph nodes, okay? And while I'm palpitating his lymph nodes, I'm going to go ahead and palpitate his sinuses also. So I'm doing the preauricular and the parotid, postauricular, occipital, jugulo-digastric. I don't know if you can see me, I'm sorry. Jugulo-digastric, submandibular, submental, supracervical, deep cervical, posterior cervical, and supraclavicular. Okay, so now I'm going to look at your neck. Look at your neck. I don't see any abnormalities or masses. His trachea is midline. Can you turn your neck that way for me? Okay, can you turn it the other way? Okay, I don't see any jugular vein distension. Okay, so I'm not going to actually palpitate his thyroid. I'm going to explain how to do it because he would totally freak out if I did it on him. So what you would do if you were palpitating a patient's thyroid is you would come behind them, put your 3 fingers on either side of their trach, ask them to swallow, and when you ask them to swallow, you would move their trach over to the side that you're feeling to palpate the thyroid, and you would feel the thyroid and then move their trach back. So let's assume that I did that to you, and you didn't die laughing. So I've already palpated the salivary glands, and I'm going to palpitate your carotid artery, and then I'm going to oscillate for a bruit. But I'm not going to palpitate his carotid artery at the same time because I'll pass out. So we're going to do one at a time. Alright. Normal. 2 plus. Alright, so when I put my stethoscope on you, I want you to breathe in and then breathe out all the way, and don't breathe while I have my stethoscope on you, okay? So go ahead and breathe in and breathe out. Okay, do the same. Alright. I did not hear anything. Alright. Can you move your neck back and forth? Your neck is popped, but you can move it back and forth. Can you touch your chin to your chest? Okay, so he doesn't have any nipple rigidity. Can you shrug your shoulders for me? Alright. Alright, so I'm about to start looking at his eyes. I have totally lost my pen light. I have no idea where it's at. So for parts of the exam, I absolutely need a flashlight. I'm going to be using his phone flashlight. So initially, I'm just going to inspect the eyes. I'll just leave it here for a second. Inspect your eyes. They look okay. You know, close your eyelids. Okay, so I don't see any masses or swelling on his eyes. Everything looks normal. Now I'm going to test for the 6 cardinal fields of gaze. That's cranial nerves 3, 4, and 6. Alright, so follow this pen. So his eyes converge on axis. Alright, so that's good. We didn't have any extraocular eye movements. So for this part, I don't have a Jaeger card or a smell and eye chart, so I'll verbalize that. So if I had a Jaeger card, I would give you a card, ask you to set it out, 14 inches away from your face, and get you to read the smallest lettering that you could on that card. And that tests near vision, which usually goes or starts to go around 40. If I had a smell and eye chart, I would get you to stand up 20 feet away from the chart, have the chart on the wall, and I would usually start about 20, 30, and cover the rest of the lines and get you to read each line down until you couldn't see anymore while covering your left eye, and then I would do it again while you were covering your right eye, and then I would do it again with both your eyes open to test your vision. Okay, so now we check Perla. Perla means pupils are equal, round, and react to light both directly and consensually. So his pupils are equal. This one I'm going to need the flashlight. Pupils are equal. They look like they're about 3 millimeters. Okay, so I'm going to just look straight ahead for me. So they react directly, and they react consensually. Okay, I don't know if I'm going to need that again. So Perla looks good. If I had not found the scope, then I would dim the lighting and check for his red reflex and look at his optic disc and his macula, but I don't have that. So what I would do next is do the corneal light reflex test. Will you look up at that light for me? Okay, you can put that down. He doesn't look like he has any weakness. Now we're going to do the cover test. So I want you to look straight ahead. Okay. And then the other side. Alright, so he doesn't appear to have any weakness. Doing the cover test. Now I'm going to move to the ear exam. So I'm going to just inspect your outer ear and palpate. Tell me if you feel any pain, okay? I don't see any abnormalities on his outer ear. And palpating it, he doesn't feel any pain. If I, had an otoscope, then I would lift his ear up and back, and I would look in his auditory canal. I'd look for the cone of light, which is at 5 o'clock in the right ear and at 7 o'clock in the left ear. And I would look at his tympanic membrane, which should be a pearly gray color. So assume that I did the otoscope exam, and then I'm going to go over this ear and inspect it, palpate it. I don't see any abnormalities. Also, I would do the otoscope exam again. So now I'm going to do the whisper test. So I want you, your little tragus, that little triangle looking together, I want you to tap it. Okay, so tap that ear. I'm going to whisper 2 words over here. I want you to tell me what they are, okay? Blue dog.
Blue dog.
Okay. Okay, I'll do that. I don't even know what word is. I don't think about this.
test went.
Okay. So this test went well. Okay, now I'm gonna start on inspecting his nose. So his nose is midline, doesn't appear to have any drainage. If you had any pain or drainage the past few days. Abnormalities. Okay, so I would, again, have an ophthalmoscope, look in his nose. Don't have that readily available. But I can check your nose for patency. So I'm going to cover one nostril, okay? Breathe out. Can you breathe out like that? Okay, same thing. Okay, so you feel like they're occluded or it looks good? Okay, so now I'm going to use a popsicle stick because I don't have a tongue depressor to inspect the inside of his mouth. I do need your flashlight again. Yep, okay. Okay, over here. Say ah. Okay, so his uvula rose up. Here, lift your tongue up for me. Okay, I was seeing white patches under his tongue, which is good because he dips. Okay, open your mouth again. Well, put your tongue out. And say ah. Okay, so grading his tonsils, they don't look swollen, they look about a 0. Okay, I'm gonna check your gag reflex. His gag reflex works. Sorry. I mean, I couldn't tell you. So, let's go to my ball. Okay, so I've already graded his tonsils. They looked okay. Have you had any issues with your tonsils before? So now, okay, so for the chest and lungs and abdomen, I'm going to keep his shirt on and just kind of work putting my stethoscope under his shirt and verbalizing through things you can't see. So, first thing I'm going to get you to do, I'm going to go ahead and get you to stand up and, oops, turn around for me. Ah, my fingers are falling. Hold on. Oh my gosh. This is not good. There we go, sorry. Got out word. Okay. Okay, so turn around for me. So I'm gonna go ahead. No. Sorry, bad direction. Turn around, like your back is facing me. Just stand right there. Okay, so first, assuming that his shirt is off, I'm inspecting and palpitating his his back. Do you feel any pain? I don't feel any retractions or see anything like that. So now I'm gonna oscillate lung sounds in his back. You know what, before I do that, I'm gonna go ahead and check for CVA tenderness. I'm gonna lift your shirt just a little bit. Here, hold your shirt. Where's that? Okay, so, well, let me put my hand here. Do you feel anything? Do you feel anything? Okay. Hold on. Okay, sorry, I should have done that. Okay, I want you to breathe in for me. Okay, alright, we're gonna check for fermentus. It's okay, I'm just gonna put my hand. Say 99.
99.
Okay. Alright, and now I'm gonna go ahead and listen to his lung sounds, starting at the apex and moving my way down to each lobe. Just breathe in every time I move my stethoscope, okay? Okay. I don't hear any adventitious sound while I'm doing that. So you can go ahead and turn around and sit down for me. Alright, so I'm going to repeat the same thing on this front, basically. I'm going to, well, except for the CVA tenderness, I would, here, let me show you. Alright. Can you read that for me? Okay, so he has symmetrical chest expansion. Can you say 99? Okay. Okay, and I'm gonna go ahead and oscillate for lung sounds again on the front. And I would oscillate using the head, and then I'd also switch to the bell to do it again. Alright, so everything sounds normal. I don't hear any rails or wheezing or crackles. I didn't see, again, I assume his shirt was off. I inspected his chest. I didn't see any retractions, no pain. Okay. So, I know you're a guy, so you probably don't do this. Do you do any breast self-exams? Okay, well, just because you're a guy doesn't mean you don't need to do them. You still need to try to do them once a month. Just make sure that it's usually best to do it once a month, right about the same time. In the shower is easier. And just palpitate around your pectoral muscles in a vertical strip pattern. And if you feel any like lumps or bulges, if you notice any drainage, any nipple inversion, any changes like that, you need to call your physician. Also make sure up here, like in this area of your axilla, that's really common for like masses, so make sure that you're also palpitating in that area when you're doing your self-exams. So now I'm going to do the cardiovascular exam, and I'm going to go ahead and, here, arms out for me. I'm going to go ahead and inspect the point of maximum impulse, which is his his apical area. I don't see any heaves or thrills. I don't feel anything. And now I'm going to oscillate his heart flat sitting and left lying with the head, and then again with the bell of the stethoscope. And I'm going to do it in a lazy Z pattern. So in all patients take MEDS patterns or the aortic, pulmonic, tricuspid, and mitral valves. That's what I'm going to listen to. And I'm going to listen for S1 and S2. So I'm going to listen to your heart right now. Okay, so, and again, if I was actually doing this in a clinical setting, then I would secondly use the bell to listen for any potential murmurs in the lazy Z pattern, and then I would get him to lay down and do the same thing again, and then I would turn him to his left lateral side and do the same thing again to potentially hear S3, I believe, is the sound that you can elicit when you do that. So now at this point, I'm going to, I've just kind of been inspecting throughout. I don't see like any varicosities. I'm going to palpitate. Skin feels warm. I don't see any edema. Great, that is 0. He does have some eczema on his legs, but no edema. And I've already done the capillary refill and clubbing. I'll go ahead and palpitate your brachials. And he did that all, sorry. I'm going to go ahead and palpitate his radial and his ulnar pulses. All his bracelets. Okay, so again, the brachial, the radial, and the ulnar, they all feel good. 2+. I'm not going to palpitate his femoral artery on camera, but if I was doing that, then I would be palpitating in this area just below his groin. and I can't, I'm gonna palpitate behind your knee, okay? So feel it. Okay. So that feels good. Okay. Alright, so now we're gonna go ahead and move to the abdomen assessment. Will you stand up and just kind of lay over the side of the bed? Like where we were practicing yesterday, like to the side, yeah. So she can see what I'm doing better. Here, I'll put this on the desk. Okay, so for the abdomen assessment, again, I'm going to keep a shirt on and just kind of verbalize what I'm doing. So initially, I'm, assuming his shirt's off. I'm looking at him. His stomach looks midline. His umbilicus looks midline. It's inverted. I don't see any masses or swelling, redness, nothing, to immediately be concerned about. I looked at his contour. Now I'm going to go ahead and oscillate for bowel sounds. You want to oscillate first because if you percuss and palpitate first, then it can cause bowel sounds to be there that are not regularly there. I'm going to start in the right ileocecal valve area because that's where most bowel sounds are commonly heard. You usually hear about 1 to 30 bowel sounds a minute, and if you're not hearing any bowel sounds, you have to listen for a full 5 minutes before you can really say this is silent abdomen. And I'm going to move in a clockwise pattern, just like I do with everything else in the abdomen. So, I'm about to teach them. Okay, so his bowel sounds were normal, they were present. Now is when I would percuss the quadrants. You want to hear resonance over lung fields or major air fields. You want to hear tympany over organs like the small intestine. You want to hear dullness over dense organs like the liver. So again, I'm going to keep a shirt on. But what you would do is you would percuss in a clock-like fashion, and you want to hear those various noises in those various areas. Okay? No. Okay. So now I'm going to move to light and deep palpitation, and while I'm doing light and deep palpitation, I'm also going to do a couple different tests. So for light palpitation, you just want to palpitate about 1 to 3 centimeters. So I'm going to press on your stomach a little bit. You just want to press about 1 to 3 centimeters. Let me know if you feel any pain or tenderness. Tenderness and pain is common over the sigmoid colon. So if I complain of that, that's normal. Okay, so now that you're done with light palpitation, I'm going to move to deep palpitation. And while I'm doing deep palpitation, I'm also going to assess for rebound tenderness, inspiratory arrest, and I'm also going to palpitate for his liver, spleen, his liver, spleen, and his bladder specifically. So, are you laughing? Sorry, he's ticklish, so I'm just going to verbalize a lot of this. So, I'm going to first do rebound tenderness in the lower right quadrant. Did you feel any pain? Okay, so he didn't feel any pain doing that. Stop. Okay, so I want you to breathe in really deep and breathe out. Breathe out. Did you feel any pain? Okay, so I'm going to go a little bit farther up here. So he didn't have a positive Murphy sign. He didn't have a positive rebound tenderness, and now I'm going to try to palpitate his liver, so I want you to breathe in really deep again, okay? And then breathe out. Okay, didn't feel his liver. Gonna keep palpitating. I'm gonna go over to where his spleen is. Okay, I want you to breathe in really deep and breathe out. Okay, I did not feel his spleen, which was a good thing. We're gonna continue to deeply palpitate. Still don't feel any, nothing of concern, and then palpitating around his bladder. Also don't feel his bladder, but that's where it would be. Okay, and now I'm gonna do. I'm done with that. Now I'm gonna do the, I can't ever say this right, iliopsoas muscle test. Now, if I had an exam table, this would be a little bit different, but I'm using a bed. So this is this is going to be a little bit difficult, but generally what you're trying to do when you're doing that, that muscle specifically runs on either side and it goes over the appendix. So if the appendix is swollen or about to burst or whatever, then there's pain upon lifting the leg and contracting that muscle. So we're going to try to engage that muscle. So lift your leg for me. Okay. Do you feel any pain? Okay. Turn your toes outwards. Do you feel any pain? Okay. Put that down. All right. So go ahead and sit back up for me. So kind of throughout the exam, I've been, feeling his joints for crepitus, trying to get him to move through the full range of motion, and testing his strength. So I'm going to continue to do that in the musculoskeletal section. So here, give me your leg. Does it hurt to bend your knee? Okay. Okay. All right. Push your legs up. Okay. So I'm going to move against resistance. All right, I'm gonna go ahead and get you to stand up for me, okay? So I'm gonna, here, you can go ahead and cut this off. So I'm gonna go ahead and test him for scoliosis. So turn around, like you're back facing me, and touch your toes. Okay, well I don't see any humps, or generally their shirt would be off for this, and if this is their first time doing this test, then you can dot each vertebra that you see, and then when they stand up, you wanna see a straight line. You can go ahead and stand up. Okay, now will you walk this way just normally so I can watch your gait? Okay, now will you walk heel to toe on the way back? Alright, good deal. Okay, so now what I want you to do is I want you to come stand in front of me, put your arms out, and close your eyes. Okay, so this is the Romberg test. You don't want to see like any, keep your eyes closed. You don't want to see like any swaying upwards. They should be able to stand pretty still for 20 seconds. Okay, you're good. You can open your eyes. Let me make sure you can sit down. Okay, go ahead and come sit down for me. Okay, so now I'm going to test for carpal tunnel. Go like this for me. So they should be able to do this for about, I believe it's 60 to 90 seconds. Do you feel any burning or sensation? Any burning or tingling sensations? Okay, you're good. You can stop doing that. And now I'm going to check for Tenelstein, and I'm going to occlude his wrist right here, and he shouldn't. Do you feel any burning, tingling? Okay. So he appears to be good with that. Okay, now I'm going to test your coordination. So what I want you to do, I want you to clap your hands and hit either knee. Clap your hands and hit either knee. Okay, so get faster every time you do it. Okay, that's good. So now, can you touch your finger to your finger? Okay. No, you're cheating. You just gotta touch your finger to your finger. Okay, now touch your finger to your nose. You're okay? Okay, now we're gonna, yeah, but you need to take your boots off anyway, because I'm gonna have to assess those two lower. Yeah. Sorry, I should have told you to do that at the start. Okay, so now I want you to touch your heel to your shin. Just rub your heel down your shin. Okay, that's good. Okay, so now that his shoes are off, I'm gonna assess his dorsal pedis pulse and his posterior tibialis. So the posterior tibialis is right behind his ankle, and then the dorsal pedis is right on the top of his foot. I'm not actually going to touch it right now because he's got a sweaty sock on. But generally they would not have socks on and I would have gloves. Let's see, we've already tested balance, test coordination. So now we're going to go ahead and test sensory. So let me grab my. Here, close your eyes for me, okay? So first, I'm gonna see if you can feel a pinprick. Did you feel it 5 times? Okay. Here. Feel it 5 times? All right, keep your eyes closed. Okay, tell me every time you feel something touch you, okay? Okay. Okay, so if I had a tuning fork, then I could test for vibration, but I don't have that currently, so I'm just gonna verbalize that. Hold out your hand for me and keep your eyes closed. What's in your hand? Okay. All right. Give me your hand. Tell me what I'm drawing on you, okay? Alright, so for the last part of the exam, generally what you would do is check the deep tendon reflexes. I don't have a reflex hammer, and last night I was practicing on him, and he told me even though I didn't have a reflex hammer, I was still like hitting his patella with the side of my hand, and I wasn't eliciting a response. So I was under the impression that I was just not hitting it well enough, and he told me, he said, oh, my doctor's never been able to get my knee to jerk. So for whatever reason, he doesn't have a deep tendon reflex, but what you would want to do is you would want to hit your reflex hammer about in this area on either side of the knee, and you would want their knee to jerk out just a little bit. And that's not the only place for a deep tendon reflex. That's just the place most commonly used. So assume I had a reflex hammer, I would hit his knee, and his knee would jerk out. And then I would try it again on this side, and it would jerk out. And then of course, the genital and rectal exams are deferred, and that's the end of the health assessment. Thank you for suffering for me. Thank you, Ms. Carter.